So I want to spend a little bit of time talking about the kind of the 3 steps that we walk you through my office to analyze you, customize you, and optimize your treatment. Okay. Now, in the first step of therapy, that's the analyze phase. So what that means is we want to make sure that we have a good diagnosis that tells us the understanding of what's going on with your sleep apnea. As we analyze you, what we're going to do is we're going to review your testing. If you've already had a sleep test done through your doctor's office, we'll make sure to go over that with you and discuss the results. Or if you have not gotten that done, my office will help facilitate that for you. That step is really important to let us know what's the severity of your sleep breathing problems and if dental device is an appropriate therapy option for you. So we have different ways we can do testing. Most commonly anymore, sleep testing is done in your home, which we've talked about in other videos. It's a relatively simple thing to do anymore, and my office will help coordinate that. Then after you've done testing, we're going to have you come into my office to do an exam. And what that exam is going to do is help us to customize therapy that's appropriate for you. Because if somebody has a diagnosis of sleep apnea, we really have 3 treatment options available. The 3 treatment options are CPAP therapy, dental device therapy, and surgical therapy. Now there's pros and cons to each therapy, and it's really important that we pick the right path for you. One of the things I'd like to talk about is how dental device versus CPAP therapy works and the pros and cons to each of them. So the easiest way I like to think about CPAP therapy is if you can imagine on this, from your nose to your lungs is a balloon, okay? CPAP therapy effectively is going to be a mask that blows air into the tube and opens up and supports the entire airway system the whole way. So CPAP therapy is first-line therapy for sleep apnea because it is so effective. The whole airway is supported, and it does not matter where the blockage point is happening or how severe the problem is. It's going to work. The downfall with CPAP therapy is that people are not as compliant with it. It's a little bit more cumbersome to wear, and there's different side effects. People will tell me that it's blowing in their eyes or their stomach, or they are feeling claustrophobic and they can't get comfortable with it. It's too noisy. So if you are not willing to put a CPAP on your face, it's not going to benefit you. Now, the way a dental device works is a little bit different, okay? Now, with the dental device, I like to imagine that in your airway, you have bone in your nose. So this part of the airway tube is supported. You have bone at your windpipe. So this part of the airway tube is supported. But the entire back of your throat is all floppy tissue that's not supported. So when you're sleeping and your muscles relax, your jaw can relax backwards. Partial blockage of the airway system would be snoring, right? Air is moving, but just not very effectively. Now, a full blockage in the airway system, that's apnea. That's what we're trying to treat based on your sleep study. So the dental device is working purely mechanically. It's similar to the head tilt chin thrust of CPR, if you're familiar with that. All we're doing is moving the jaw a little bit to create more room in the back of the airway, okay? So we're gonna create a brace on the teeth that's gonna prevent the jaw from falling backwards. In addition to it has the ability to pull the jaw forward, okay? The back of the throat, the tongue, and the soft tissue back there is the most common site that the airway is blocking, which is why the dental device is so effective, but it is only able to manipulate one small section of the airway. So one of the biggest downfalls of the dental device is that unlike CPAP that's manipulating the whole system, dental device helps part of the system. So some people just don't respond as effectively or as fully to the dental device alone. And again, that's why we do an exam to try and identify any potential limitation that we may see that could prevent some of the success. Now, if you compare side by side CPAP versus dental device and how well they work, it's a little bit different, okay? CPAP is 100% effective and guaranteed, if it is on, to be treating your sleep apnea. However, about 50% of people are able to tolerate it through the night. The dental device, on the other hand, is about 70% as effective at managing the sleep apnea, but about 90% of people can wear it comfortably through the night. So it's a little bit of a kind of a teeter-totter of how well it works versus how well people are able to use it. And most commonly across the general community, the consensus in the medical community is that the overall impact to your quality of life and your health between the two therapies is about the same, right? There's something that works really well that you're not wearing as often versus something that doesn't work quite as well, but that you can wear more frequently. You're probably going to get similar health benefits with the both. Now, dental device does have some downfalls, okay? The downfall of the dental device is that it is custom made and custom built to your mouth. There are 150 different kinds of appliances available on the market. So it is my job to select an appliance that I think you're gonna be able to tolerate, which is why our success rates are so high. But if you do not like it, you can't give it back because it won't benefit anybody but you. They are also designed to fit tightly on your teeth. If they are not tight, they are not as effective. And so that is something that we talk about in our follow-up phase and our kind of optimization phase, is that if there's any sort of discomfort or limitations that's preventing you from wearing it, typically I can correct and adjust that for you to improve your tolerance of it, but they are tight. Now, a lot of times people will tell me that they have, TMJ issues, jaw pain issues, so that they're not a successful candidate for a dental device. And I tend to disagree with that. I think that that should not be a barrier to starting therapy with the dental device. It just is kind of something that's going to guide us into appliance selection for you, because we just need to allow the jaw to move comfortably based on your anatomy. Some people do experience some temporary, jaw muscle soreness or stiffness once they first get their appliance, but typically it resolves pretty quickly once we get them into the right spot with treatment. One of the last things that we would see as a potential side effect for the dental device is bite change. Now, I think that bite change is a preventable side effect if we're paying attention and if you follow the instructions that I provide to you. There are two ways that your bite can shift. One would be more of an orthodontic type of movement where the teeth themselves are wanting to shift or drift. And the way that we can prevent that bite change from happening is, like I said, by making the appliance fit tightly on the teeth. That will prevent some of that movement. Additionally, we have some people that will have them wear retainers for a brief period of time during the day, and that can also be another layer of security to help prevent some of the bite change. But more commonly, what we would see with bite change is a more kind of full body movement of the jaw where people's teeth aren't wanting to line together in the back and they lose some of that connection of the back teeth. So the way that we can prevent that movement from happening is by doing some very simple exercises in the morning. And we also, as part of your therapy plan, make a little repositioning piece that you put in first thing when you wake up, and that will help to reset the bite to come backwards. So the bite change is a side effect that we can easily be monitoring for and preventing if you're paying attention to your body and the care plan. Outside of the side effects, people tend to do very, very well with the dental device, and a lot of the side effects are relatively short-lived, and I will help to kind of mitigate them if they do come up. Now, after we've built the appliance and put you into therapy, we're going to make sure that we kind of optimize your care plan to get you in the best spot as possible to get your sleep quality as improved as we can. If for any reason you are unsuccessful with the dental device or unsuccessful with a CPAP, then we would consider potential surgical therapy, which is the third treatment option for sleep apnea. And typically surgical sleep apnea management is completed by ear, nose, and throat doctors or oral surgeons, and my office could help shepherd you down that path if needed. Most of the time, people are very successfully managed with either a CPAP or a dental device or a combination of the two. And so my office will make sure that we answer any questions that you have throughout the process and do everything we can to optimize your care.